This is the first event in our new KUOW series, The First 100 Days, an event series chronicling the first 100 days of the Biden-Harris administration. We're doing this in conversation with leading NPR and BBC correspondents, including Anya Kamenetz, Anthony Zurcher, and Scott Horsley, as we explore the top issues facing the new administration, including COVID-19, the economy, education, immigration, U.S. relations, and more. Each event is free and will be streamed live on KUOW's YouTube channel. For our virtual audience today, welcome, and we would love to hear from you during this discussion. Please share your questions with us in the comments section. I'll be monitoring them as they come in to include them, so we will try to get to as many of your questions as we can. Well, today we are talking about COVID-19, and I would like to welcome Allison Aubrey, correspondent for NPR News, whose stories you've heard on Morning Edition and All Things Considered. Allison is also a contributor to the PBS NewsHour and is one of the hosts of NPR's Life Kit podcast. Allison works with her colleagues from the Science Desk, which for the past year means working almost nonstop on what may end up being the biggest story of her career, COVID-19. Allison, welcome. Allison, can you unmute yourself? You are unmuted?
Hi, there we are. Good to be.
Thank you. It's great to hear from you too and see you. Thank you for doing this with us.
Of course.
We are almost a year now since our governor here in Washington state revealed the first COVID case from community spread, and soon after, the first death from COVID in the U.S. And that happened at the Life Care Center in Kirkland, just a few miles from where I'm sitting right now. And at least 35 people died in that initial outbreak. And now here we are. It's 1 year later. And as a reporter, what are you thinking of as we get into all of these 1 year anniversaries connected to this pandemic?
I think back to a year ago when Imperial College released modeling data suggesting that we all might have to disrupt our lives for 18 months. And I remember sitting around a table of editors and reporters and saying, there's no way you can keep kids out of school for 18 months, shut down society. What is this crazy? I mean, it seemed crazy, right?
That long, yeah.
This was, before we had been told perhaps a 2-week shutdown was going to help, was going to work, right? And I think back to that and I think, wow, all the infectious disease experts, as well as historians who had studied, the 1919, the flu epidemic, they realized pandemics last 2 years.
Yeah, exactly. And before we get into the science and the health aspects of all of this, I do want to acknowledge the enormous toll that this pandemic has taken, the devastated economy here in this country and around the world as well, but mainly the pain and the loss that it's brought to so many of us. Over 400,000 Americans dead already. There are some models that predict we could hit 500,000 people lost later this spring. We do have a graphic, I think, of this. Here we are showing it, and it's just this long curving line upward of deaths. And these numbers, they can become a blur. We can numb ourselves to it over time. It just becomes too much to process. And for you, I'm wondering, is there one story or one person who stands out for you in all of this?
Well, my father-in-law, he died from COVID-19 this summer. He was diagnosed around Easter. At that time, it was new-ish, right? He was in New York, so he was in the first wave of all of this. And when he was diagnosed, he actually didn't feel so bad. He never went on a ventilator. He did go to the hospital. He required oxygen, but he was always able to breathe on his own. He was released from the hospital. And then, 6 weeks later, the toll of the disease on his lungs took his life. And I think that's pretty, now we understand why that is. We understand how the virus attacks so many organs in the body. We hear about these cytokine storms that happen at day 7 or day 10 or what have you. And for a person of his age, his lungs were overtaken. He had what looked to be double pneumonia when you would look at the images of it, and he died. So when he died, there weren't so many deaths in the US, but now I think about how many people out there listening right now have someone just like me, someone in their family, somebody close by, right? With the number of deaths that we've seen, this is just close to a lot of people.
How did you and your editors kind of decide to approach it at that point? I mean, that's such a terrible loss. I am so sorry. And as you say, that was right at the beginning of things.
Yeah, I didn't talk about this on the air until we had lost 100,000 people. And so much of what I watched my husband's family go through as they were trying to manage his care. 3 of his siblings are physicians, and having daily check-ins, it was very hard early on to know, was he getting better? Was he getting worse? Were the blood thinners working? What medications help? What don't? And I think now, even though the death toll has been very high in recent months, there are a lot of people getting COVID, going to the hospital, getting treated, and getting better. So, there's 2 things happening at once. Yes, the sheer volume of people who've been infected and become sick increases the overall numbers of people who end up in the hospital. And of course, we've seen that in the death toll as well. But the number of people surviving and getting better is quite high, and care has improved. Doctors have a lot of tools in their toolkits and understand the disease a lot better. None of them are curative, but many of them help.
Mm-hmm, mm-hmm. Amazing. How far we've come in just these months. And I just want to give a little tip of the hat here to the hundreds of thousands of healthcare workers, doctors, therapists, nurses, technicians, the folks who clean and sanitize the rooms, the people who keep healthcare facilities going. We've got some more images that they were taken by KUOW's photojournalist Megan Farmer during this pandemic. And Allison, you've spoken with people working in this field over the past year. You've got folks in your family, as I'm learning, who work in the field. What is the workload that they're dealing with? What does that reveal to you?
I have spoken to a lot of nurses and physicians, people on the front lines. And one thing that strikes me is that when there are emergencies, or when you think about an emergency, when you think about a natural disaster, so, storms and fires that land people in the hospital or hurt people all at once, those things typically last a few days, a few weeks, right? We've had this pandemic going on for a year, right? And when you talk to nurses and doctors and people on the front lines in these hospitals, there's no end in sight. They're so burned out, and there's a physical toll to taking care of COVID patients. Keep in mind that in an ICU, in a hospital in general, the average stay tends to be a couple of days up to a week. With COVID patients, the average stay is 3 weeks or more. People are in the hospital can be in the hospital for a long time. And one of the best practices that has emerged to take care of patients is to prone patients, right? Flip them in their belly and then turn them back over again. And I spoke to a physician, a nurse actually at UCLA, and she said to me, think about, you have all of these patients. Not only are you managing at 100% capacity, you have none of these patients typically have family in the room, given the precautions. You're completely suited up, so you can't sort of have normal interactions with people. There's a loneliness factor. You're physically flipping them 6 times a day, and they have 9 IV lines in them. Like there's just like a physicality to the work. I mean, nurses are used to working, doing a lot of that kind of work, but there's a physical toll and an emotional toll, obviously, to taking care of COVID patients.
And it's been a year, and we are seeing some light on the horizon, but as you say, it does take a toll physically, mentally, emotionally, all of that. Are you concerned about where our healthcare system is? Are there any threads in that story that you're curious about, that you want to track in terms of how it's holding up?
Yeah, well, I think when when there in instances where people could walk away from the job because they didn't want the risk of working in a hospital or the exposure, or somebody was immune compromised themselves, or towards the end of their career, if you could walk away, you did walk away. That's been the case for many healthcare workers, and understandably, particularly people who are at high risk themselves. And so it really, really, really depends. What has mostly struck me is that, if you are a nurse at UCLA right now, which is a very well-resourced hospital system in a major city, there are resources there to help you so you don't get burned out, right? They have meditation rooms and wellness coaching and all kinds of services that they offer. And they're very proactive about thinking about the wellness and well-being of their workers. And that's a luxury. It's part of being in a very well-resourced community and well-resourced institution. And then I've talked to folks in small rural hospitals in Iowa and in Kentucky and places where they don't have a bed. They've got people waiting, and they're trying to transfer patients to the big city hospital, but they can't get them there on time, but they still have to take care of them. And they're understaffed. And the reality is, like, everything about this pandemic has shined a spotlight on, the sort of have not, the sort of divisions within our healthcare system that have always been there. And they're just easier to see now. I think they were sort of hidden in plain sight before, but I think these things are exposed.
Right. And now that they've been seen, I guess the question is, can they be unseen as we move out of this pandemic? Yeah. I'm remembering back to last spring, Allison, when the fear of the virus was really high at the beginning, and there was quite a bit of buy-in for the initial spate of lockdowns last spring that did end up helping to bend the curve, and then it seemed to reduce the spread on the two coasts, east and west coasts, where it had broken out. And then the virus showed how contagious it was again when restrictions were eased in some states. It then spread in the Sunbelt states and the Midwest over the summer, beaten back with mask usage, and then it surged again over the holidays. You've seen this all play out across the country in these different states. What do you make of how different parts of the country and the federal government last year handled their approaches to public health?
Public health folks will tell you all public health is local, right? So you want to have trusted officials that you look to in your community to give you guidance. So I completely get it, why governors had roles here, why county and state officials and local public health people had important roles here. I think the missing link all along is that it's a lot easier to make decisions when you're the governor or you're a local public health person or you're a school superintendent, for that matter, if there is consistent, clear, evidence-based guidance coming from the mothership, coming from the federal government, right? And that really has been the missing link, or was the missing link, and was very frustrating. I can remember talking to a school superintendent in West Virginia last August as they were about to start opening up. And I was asking him, well, what are you doing about the buses? How do you keep kids distanced on buses? I was asking, how are you actually going to do this thing where you screen for temperature? And, I was asking him all these details, and he was like, we're figuring all of this out, but we're basically doing it by ourselves. And even the decision to open, right? There wasn't a clear guideline of, say, hey, let's use this metric. Let's agree that this metric is helpful. This will depend on where you are. The manifestation of it will depend on where you are, but let's agree that X cases over 100,000 means the level of community spread is so high, maybe not, let's put off opening up the schools. There wasn't this kind of, guideline, national guideline. And so we saw people having to make their own decisions, and that made it a lot harder.
Right. And made them perhaps in some instances more politically vulnerable to attacks or people challenging certain decisions. Yeah.
Yes. Public health folks. Yes.
Yeah. One of the biggest aspects of this story that struck me has just been, as you say, information of the virus, about the virus, how little we knew about it at the beginning, what we were told to do to protect ourselves and others, the messaging, as you say, around public health, who delivered it, how it was delivered. And then there was this parallel explosion of misinformation online. which is just so much. And what struck you the most about what the public was told about the virus and how we, the public, how we reacted over the past year?
It kind of depends on which phase of the pandemic you're talking about. Early on, there was a moment, like all of us covering this early on. So I was covering this before we were watching very closely what was happening in China, watching and waiting, and it was becoming clearer and clearer that we weren't going to be able to keep this out, right? And so I remember, the press conference with Nancy Messonnier of the CDC in February, where she said, "Look, folks, get ready. I told my children at breakfast this morning, our lives are about to be disrupted," right? And that was a big, major departure from what public health folks have been saying up to that point. If you go back 3 weeks before that or 4 weeks before that, the sort of line was, we're watching, we're concerned, but still at this moment, the risk of flu is probably higher to you than the risk of catching COVID, right? And that was true for a long time. And then all of a sudden it wasn't true. And so people had a really hard time with that, right? Like it kind of changed dramatically. And so some people came on board with, okay, the situation is fluid and it's changing quickly. And some people got stuck at, oh, don't worry, this is like no worse than the flu, And you think about that divergence. Why did some people come along with science and some people didn't? It breaks down along political lines, and we've seen how that has manifested. I will point out that when we think about the response, there is a sense out there that there's a large number of people who were fighting masking, that, oh, look at all the anti-maskers. And so look, NPR has done a lot of stories about anti-maskers as all media outlets, because they're there and it's real. However, I would point out that if you go back and you look at public opinion and polling data throughout, pick your poll, Ipsos polls, Pew polls, when people are asked, are you willing to mask? If evidence shows it's helpful, are you willing to do this? And guess what? The majority of people are. And so do we need to be at 90% compliance or higher? We do. And did it take a long time to sort of get there? Yes. But I would say that the voices of the few were amplified, and it concerned me because I think that we undercut the idea that, most people, and when I say most, it was over 60% of people saying, like, show me the evidence that it's helpful and I'm there, I'm doing it. And so, it's one of these really unfortunate, and obviously politics played along into that. We didn't have a White House where the recommended public health behaviors were being modeled, right? And so that perhaps, exacerbated this divide. But I do think we should give people more credit that most people want good information, and given it, are willing to follow it.
Allison Aubrey is a correspondent with NPR, and she works on the science desk. She is our guest today. And throughout our discussion, please share your We do have quite a lot of interest in this part of the world around misinformation and disinformation. And we did get this question from our audience. This is from Sherry on YouTube. She writes, rumors persist that doctors and hospitals generate more revenue when reporting deaths as coronavirus. Are there any sources that you would suggest to convince people otherwise?
This is trying to feed into the argument people aren't really dying of coronavirus. Wow. Sometimes it's hard to answer these. I've seen the death certificates, and usually the way it's done at the state level, so it varies, but usually there are multiple causes of death listed, and I don't know, many times it's not the hospital filling out the death certificate. So that's what I don't understand. I'm even kind of a little bit confused by the question. I know that in New York State, the funeral home can be authorized to fill out a death certificate. So yeah, there are going to be multiple causes of death listed, contributing causes in these COVID cases. I've never, sorry, I don't have a good answer because I haven't heard people push that one through.
Yeah, no, that has been an online rumor I know that was circulating earlier this year. Somehow, yeah, the financial picture, it just does not pencil out in favor of healthcare systems and public hospitals. That would be some sort
No,
of profit motivator. That's just an
no.
incorrect premise, I believe.
Yeah, no, I mean, if anything, when hospitals are over, yeah, let's leave that one there.
Okay, yeah, fair enough. I'd like to talk about one of the rock stars, maybe one of the few who emerged in this past year, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Can you talk a little bit about his role in the Trump administration and how he served as a source of information for you, for reporters, for the American public in the past year?
Yeah, so, right, he's been the voice of reason, the voice of calm, the voice to listen to. Look, Anthony Fauci has served under every president since Ronald Reagan. He's been through a lot of this. He's unflappable. I recently spoke to one of his deputies, and I asked her, how is it that he can have all of the information at his fingertips for press briefings that go on hours or live interviews that go on for 10, 12 minutes. He always has the information at his fingertips and the right thing to say, and he never takes the bait. He's unflappable, right? He's calm. And she said, look, that he's got a lot of really great people working with him, feeding him the latest information. It's a team effort there. But he's a guy who's just keeps on keeping on. And it seems like whenever you turn on the radio, turn on the TV, there's Dr. Fauci, right? Here in my neighborhood, and maybe where you guys live as well, there's the Dr. Fauci yard signs. People love him. They adore him because he's been the voice of reason and and the steady hand through all of this.
Yeah, absolutely. Definitely bringing information, whether it was welcome or not, a truth teller to people when they really wanted some facts. Well, now he's got a new boss, President Biden, a new sheriff in town, so to speak. And Dr. Fauci seems to be quite okay with that, welcoming the change.
Yes, yeah.
One of the things that was very clear as recently as about 15 minutes ago when I was with the president is that one of the things that we're going to do is to be completely transparent, open, and honest. If things go wrong, not point fingers, but to correct them and to make everything we do be based on science and evidence.
Science and evidence. There you go. Allison, what does Dr. Fauci and the Biden administration at this point, what do they need to do to build and maintain trust with the public?
Yeah, I think the main thing they need to do, Dr. Fauci just laid it out right there. It's sort of, transparency is key. And I think the other thing is sort of everybody singing from the same hymnal, right? We saw a lot early on with like, oh, okay, everybody wear a mask. That's a new guidance from the CDC. Oh, but maybe I won't wear one. I mean, if you want to wear one, that's fine, but I don't think I need to wear one, right? So that wasn't helpful, right? So unifying messages like, coordination, transparency, everyone singing from the same hymnal. I will say that, there's a lot of rolling out the vaccine that the administration can't control, right? So for all of you hear about, oh, this has been, a very rocky start, we weren't getting in shots in arms fast enough. Part of that, I think people need to recognize it's, we have a very decentralized and fragmented healthcare delivery system, right? There are thousands upon thousands upon thousands of providers who are going to be delivering this shot. So there are everything from pharmacies and hospitals, mega sites being stood up around the country. It's a very decentralized way of operating because that's what kind of system we have. And you can't snap your fingers and change the reality of that, no matter who is in the White House, right? So, I mean, there are going to be things that continue to be frustrating and continue to take time that transcend who is in the White House.
Right. Well, we do have President Joe Biden here. He's been busy in his first couple of weeks in office, issuing a flurry of executive orders related to getting this virus under control. We've got a clip here of what we'll be playing of him in a minute. But as a part of those orders, he appointed a federal coordinator for COVID response. He invoked the Defense Production Act to strengthen the national supply chain for PPE and pandemic response, along with multiple others.
We didn't get into this mess overnight, and it's going to take months for us to turn things around. But let me be equally clear. We will get through this. We will defeat this pandemic. And to a nation waiting for action, let me be the clearest on this point. Help is on the way.
Allison, you touched on this before. It may not, because of the decentralized nature of our system, it may not, in some regards, not matter too much who is at the top. But what are the biggest differences that he can make now?
Well, I mean, some of them were the low-hanging fruit, right? Like, I mean, day one, there is now a mask mandate, on federal property and on the interstate highway system, right? Like, that was easy to do. I think there's a lot of different things that we're going to see here. I think the National Guard deployments associated with the pandemic, the testing board to boost testing. Testing still plays a very large role in controlling the pandemic. Just today, I was talking to a researcher at Imperial College in London, and he explained because of the variants there, when they do genomic sequencing and they identify a variant, then they basically knock on the door or get in touch with everybody in that zip code where they have identified one of these contagious variants, these emerging variants, and they say, hey, go get tested. It doesn't matter if you're symptomatic, we want you to get tested, because they're trying to contain these variants. So testing plays a large role. That's something that very early on in the transition, Biden made a big to-do that he would expand testing. So we'll see more of that, the federal government buying these instant home tests, more studies and trials on COVID-19 treatments, more guidance to schools on when and how to safely reopen, directing OSHA, the Occupational Safety and Health Administration, to provide guidance for workplaces safe reopening. And also we're going to hear a lot more about the Health Equity Task Force to make sure that underserved communities that have been hit hardest by the pandemic are really treated more fairly.
Yeah, there's a lot there. And we will be getting to education in schools, I think, in just a little bit. But if I can touch on vaccines for a moment, some of them have now been approved for emergency use. And the rollout of these vaccines, Allison, this has to be one of the most closely followed stories by our listeners during this whole pandemic. I'm sure you are getting a lot of questions about it as well. So let's start with who are getting these vaccines right now and at what rate they're getting it. The priority groups we've known about for a while, folks who are older in nursing homes, the frontline healthcare workers, that group is first in line. But as they are rolling out, what are we actually seeing in terms of who's getting the vaccine in these initial stages?
Yeah, well, as you say, healthcare workers, now states have opened it up to 75 and above and 65 and above in many states. And, that's a big group of people once you've opened it up to 65 and above. So millions of people. And I think that's, at this moment in time, it's why every listserv across the United States of America is lighted up with people saying, hey, did you hear this hospital just opened its registration for X group, 65 and up. Hey, did you hear Kaiser Permanente down the road is doing them? Did you hear this? Did you hear that? Are you on this list? You on that list? So there's a lot of vaccine shopping going on, right? People are hearing about different lists to get on. And we've all heard about canceled appointments and supply chain disruptions. We know that there are not 400 million doses of the vaccine sitting out there waiting to be put into arms right now. So people are hustling to find an appointment. I just spoke to a vaccine manager at a major hospital system in Pennsylvania today. And I said to her, what is surprising for you guys? They've got 4 stand-up vaccination sites up and running right now. They're doing about 3,000 a day, and they've already gotten their whole staff, vaccinated. And she said, the biggest surprise that we're having right now is that people make appointments to come in and then they are no-shows because they have double booked somewhere else, right? The local CVS or whoever down the street now has the vaccine. They were able to get an appointment there and they didn't want to cancel one because, oh, what if one got canceled, right? And so, this is frustrating for the providers. Like they're just now getting the capacity going. And here you are with one of the vaccine has to be used within 6 hours of the vial being punctured and you have a no-show. So, this is not an easy thing to do, to administer this tricky vaccine to, millions and millions of people. Right now, we're doing about 1.5 million, or the US overall is doing about 1.5 million shots a day, which, that the original goal that Biden had coming in was, 100 million shots in the
first 100 days.
For the first 100 days. And yeah, we're on pace to do that. I mean, even the week of his inaugural, in that period was already sort of ramping up to 1 million a day. And so we're on pace for that. But look, there are a lot of headwinds to this because, there's just a few manufacturers. It's a very centralized process. There's just a few factories in the world producing these things. There could be supply chain snags, disruptions, the way we saw with tests. And so, it's all going pretty well. I think that my personal opinion is there was just so much shade being thrown at everybody whose job it was to get these vaccination sites up and running. And everyone was complaining, oh, this is off the rails. Well, it was a rocky start, but we are moving at a good clip now.
Yeah, interesting. I'm just curious, what did that hospital administrator tell you about when they've got this mass vaccination site up and running? They have a no-show. What do they do? How do they adjust in the moment?
Well, I think for the moment, it's okay. So it depends on sort of where these vaccination sites are. So I think this is very variable across the country. You've probably read about, we all know about when you fly on standby. Well, there's now like standby vaccination lines, like you hang out. If there's a seat left, you fly. Well, if there's a vaccine left. So some places have kind of allowed, wink, wink, nod, nod, the standby lines. I know of a situation here in the Washington area. A colleague of ours happened to be in a pharmacy when this very thing happened. It was the end of the day. The vaccination team had come back from a nursing facility and they had unused shots. And they basically said to people shopping in the store, we have these shots that we...
Attention.
Yeah, exactly. So, it's been a lot of like sort of catch as catch can. And yes, there's a system in place, but the system, there's 60,000, there's thousands and thousands of people involved in rolling out this system. So I think, lots of people, I'm sure, are swapping these stories about, how they scored a vaccine, by hanging out at a pharmacy or by standing in one of these, standby lines.
It just seems so random. Talk about luck of the draw. Allison Aubrey is our guest today, a correspondent with NPR, and she reports on COVID-19. And Allison, we got a question earlier, and this is about seniors. She says, is the vaccine getting to our low-income seniors in Washington state and elsewhere? Many don't have the means to get online easily, which, Allison, I think points to a question about, some people phrased it as the digital divide. But I mean, we've got a lot of folks who are not, they don't always feel comfortable navigating what is a complicated system. And then, it's online as well. How are you seeing people respond to that?
Yeah, there was a piece that we had online today where one of the sources said it's cruel, the system we have, because seniors can't keep, if you've got somebody younger helping, if you have an older relative. So this happened in my own family. My mother was hoping to be vaccinated. She is 75. So, she was not cutting the line, right? She was due this shot. She had been an outpatient at a local hospital within the last couple of years. So she met the criterion for being vaccinated at this particular hospital. And so my brother-in-law kept refreshing till he finally got an appointment for her, right? I think she would not have been as, prone to do that. She had this sense of like, oh, she told me 5 times, I don't want to go first. If anybody needs it more than me, I want them to go first. Like, Mom, you deserve the vaccine. Like,
you're eligible.
Right, you're eligible. You're not cutting the line here,
Yeah.
And so she sort of felt guilty about the sort of ethics of it, but she had an advocate. And we all want an advocate for our older relatives, right? And so for people who don't have advocates, or for people who are impacted by the digital divide, yeah, these are concerns, right?
Yeah, and we are seeing, I know you've seen them too, like, as you say, advocates, there's crowdsourcing is happening, neighbors are helping, there's a great effort around this. But again, it just, like you say, speaks to how incredibly fractured our healthcare system is and
right.
decentralized it is. And just for the folks who are watching and listening, I just want to say that our interim news director here at KUOW, Deb Wong, she came on with me on All Things Considered yesterday, and she ran through what she encountered in the process of trying to get her 91-year-old mother signed up for a vaccine. And she's got a lot of tips and tricks that she pulled together about how to navigate the system. She put it all into one place. So it's at our website, KUOW.org, and we'll have a link to that in the notes at the end of this event here as well.
So what were the top ones?
Well, this is great, because I was just about to ask you. She recommended that the best place to start was with your own health provider. Is that what you're hearing as well?
No. So, well, what I'm hearing, well, it's not a bad place to start. And if you're part of a primary care group, they probably have, and you're hooked in it all, electronically, they've probably already sent you a message. Like here in Maryland, small doctors' offices have not been getting, supply of the vaccine, right? It's like the hospital centers and the larger vaccination sites and the pharmacies, right? So, I have been inundated with the, personally, and I've heard from so many listeners and people I've spoken to, that what they hear from their doctor is, don't call, don't ask, we don't have a list, it could be months. We don't have supply, right? Because that's really not where the supply is going. And each state is prioritizing this differently, right? So it's at the state's discretion how these vaccine shots how the doses are parceled out, right? So you've got the pharmacy program and more doses going to pharmacies. You have hospital programs and sites the hospitals are running. And then you have all the other players trying to get their allotment. And, I spoke to a woman last week in the Philadelphia area, and she had set up a clinic for unaffiliated healthcare workers. So these would be home health workers. They're totally, eligible, but they're not connected to a hospital or a doctor's office. And so this was the group she was trying to serve. She set up a mobile clinic. She hired people. She had been promised some doses. It's a week-to-week allocation. And some weeks she was getting her allocation, some weeks not, because the supply chain is, sort of accordion at the moment. And this is really hard for the providers, because she set up a business trying to vaccinate healthcare workers, yet it's been unpredictable how many doses she's been able to get. So yeah, it's been a rocky start. Yeah.
It has. But as you say, the volume does seem to be going up. There is more vaccine being shipped.
The pace is accelerating.
Yeah. We got another question kind of connected to that as well, about the allocation of vaccines. And this person wrote to us and said, for example, I've received my first Pfizer vaccination, but I understand there's no guarantee that the vaccination provider will have more Pfizer vaccine for the second shot. Are you hearing stories like that as well? And are you hearing any best practices about how people should handle that question?
Yeah, I mean, the advice is, and you're supposed to get your second appointment when you leave, when you're there at the site getting your first shot. I mean, that's the way, in theory, it is supposed to work. Are there instances or times when the supply isn't going to be there when it's time for the second dose? We'll see. I think that right now, the recommendation is that you stick to the interval of the 3 weeks or the 4 weeks, depending whether you're getting the Moderna or the Pfizer. However, the CDC has said in anticipation that this might become an issue for some people, that on the day that they're supposed to be getting their second dose, their provider doesn't have it or they can't get there. The CDC has said that it is fine to wait up to 42 days to get the second shot. And, so there is wiggle room there. And I think we'll have to just see how it plays out. Yeah.
Right. And I think Dr. Rochelle Walensky, the new head of the CDC, was saying that, in rare instances, if you lose track of which shot you got, that you could get a second dose of whatever vaccine, mRNA vaccine, is available. So that might also start to.
Yeah, I think that they're saying you should try to get the same one, but there are instances where that would be okay. So I think if you actually read the guidance, it's actually printed on the CD. I just looked that up a couple of days ago because they had updated it, and the guidance is you should aim to get the same, but if there might be circumstances where you would get the Moderna on the second shot. Yeah.
Right. Exactly.
If you got Pfizer in the first. Mm-hmm.
Allison, I don't know what you're hearing on your side of the country, but around here, we have had reports of people jumping the line. There was a big flurry here recently where several Seattle area hospitals were revealed to have offered vaccination appointments to some board members and donors and volunteers. And this was at a time when public vaccination appointments were full or were booked out into the next, month or two. Have you seen this elsewhere? Do you have a sense of how big an issue this is overall?
I think it's going to be really hard to tell, though I will say one of the concerns that has been raised about the pharmacy program is that, it's going to be the honor system, right? Like, are you really eligible right now? If you're sort of a yoga teacher, do you count as an essential worker because you're a teacher? But you're not really teaching yoga classes right now. I don't know. Like you might think of yourself as a teacher as 1A. Are you really? This is going to come down to how honest are you being, right? There's going to be a big, honor system component to this. And it came up at our meeting today because I think that, if you're getting your shot through a hospital system or through your integrated care or primary care system, they know who you are, they know your age, obviously. You go to CVS, maybe they do, maybe they don't. It's wink, wink, nod, nod. So it's still unclear what, if any, screening the pharmacies will be doing as they give these out? I don't think the pharmacies want to be placed in a role of having to police eligibility. And I don't know that it will be entirely possible for them to do that. I don't have any details about what information you have to share when you show up to a particular chain. I think it might vary chain to chain. But I do think, given the urgency and the pace with which we're moving, it's not going to be an uncheatable system.
Right. And then we have the issue of folks who are hesitant to get the vaccine. And that includes some folks that some people might not have expected might fall into that category, like some workers in nursing homes. Let's listen to a short clip from your story that ran last week on All Things Considered.
It was disappointing to actually, sort of see that in black and white.
That's Katie Smith-Sloan, president of Leading Age, a trade group that represents thousands of nonprofit providers.
Obviously, we hope that the percentages increase of staff who avail themselves of this vaccine. And my hope is this wait and see will turn into wait and do.
Allison, great story. I believe you report that only between 30 and 60% of nursing home staffers have taken a shot. And I think that's perhaps nationwide, or perhaps that was just in the sample that you were looking at. How are folks overcoming that in these nursing facilities?
Oh, it's been interesting to talk to the nursing facilities because they've got a lot of education campaigns going on. They're also they're trying to create sort of a festive atmosphere to the vaccination clinics, right? They're playing music, they're having Jell-O shots, virgin Jell-O shots. They are offering gift cards or a day off or some kind of financial incentive. I mean, education needs to be at the centerpiece of that, right? They need to have their questions answered. And people need to be met where they are, right? Like, it's kind of rude to say to someone, oh, you don't want to get vaccinated, just get with the science. The science says it's safe. That can be very condescending, right? Because the people have valid concerns. You know, one nursing home director told me, or the vaccination manager at this facility told me, that many of their workers are women of childbearing age. And if you go on the ACOG website and you read their statement, you might be like, I'd like to wait, because the ACOG statement reads something along the lines of like, you know, there's not a lot of data yet, and we don't think it should be withheld from women, but it reads, if you're not in the know, it sounds very equivocal, right? I mean, and because there hadn't been a lot known, and so people have valid concerns. People need to have conversations with informed people so that they can make a good decision. And I think that is sort of what's happening right now. I know that the hope was that a lot of the healthcare workers in these long-term care facilities, they may have said no thank you to the first vaccination clinic. But now that we see, we have nearly 25 to 30 million people who've gotten their first shot, the risk of adverse reaction is very, very, very low, right? The hope is that the hesitancy will wane, and certainly national polling suggests that it has begun to wane.
And there are also deep historical concerns and reservations among communities of color who have not had great experiences with the medical system.
Yeah, I mean, the national polling suggests that hesitancy overall, I think I'm recalling a recent Pew poll, and I don't have the exact numbers in front of me, but my recollection is that overall about 60% of people were saying, yeah, I think I'd like to get it when it's available to me. And that number was significantly lower, sort of like in the 40% range when they broke out Black respondents. And, I think I did speak to one nurse about this, and she even said, like, yes, she said, look, I'm constantly telling my family members and my friends, sharing the information I have about the importance of getting the vaccine. She said the story that I like to share with folks is to say, hey, look around you. People in your own community might be being hit harder by COVID-19 and they could benefit from this vaccine the most, right? And so I think what the evidence shows is that there needs to be a lot of peer-to-peer coaching, right? There needs to be somebody in your life to look to for good information. And I think that we will see that those numbers will come up, but I think the historical reasons for the hesitancy are understandable.
Right, exactly. Just pointing to a crisis of trust happening in the country right now on multiple levels at a time when we are isolated, just compounding the problem.
Of course.
Allison Aubrey is our guest today, an NPR correspondent, and we are discussing the first 100 days of the Biden-Harris administration and what we are looking to see what could happen with the COVID-19 pandemic. Please, if you've got questions for Allison, it's not too late. Just drop them in the comment section and we will do our best to try to get to them. Allison, a question from Anne on YouTube. Do you think the FDA will authorize the new vaccines like J&J, which I think is Johnson & Johnson, or AstraZeneca?
Yeah, so the Johnson & Johnson is expected to file for authorization in the next couple of days, and it will be the job of FDA advisors to review the data that Johnson & Johnson has already talked about last week very publicly when they shared their findings that their vaccine, the one-dose vaccine, does seem overall to be quite effective, not as effective as Moderna and Pfizer, but overall very, very effective at preventing the things that are most important, which are death and hospitalization, right? So if you were to get it and you're vaccinated, you're not going to get as sick as what the initial data suggests, according to how Johnson & Johnson presented it. This is, of course, the time when independent scientists review the data, and then they would make the authorization, and that is expected to happen fairly quickly. I think it would be a game changer to the supply. There are concerns about keeping up with supply, and having this option available would put a lot more vaccine out there, or could put a lot more vaccine out there.
All right. We'll keep a close eye on that as that emerges in the days and weeks to come. I want to ask you a bit about how researchers are still learning more about the long-term effects of COVID-19. The folks who get over their initial bout with it, but then they're dogged by this range of symptoms that just won't go away. What do we know at this point about long haulers? And if there's any long haulers who are paying attention and are tuning into this, what would you tell them?
Yeah, well, I've done a bit of reporting about this. I think there's a lot more to dig into because of the range of ongoing symptoms that people have. I know that primary care doctors don't really know what to say, know what to do, right? This is new. And so at this point around the country, there are a few post-COVID clinics popping up. There's one at Hopkins in Baltimore. There's one out in San Francisco at UCSF. And so I do think that as, you know, these, and what the approach of these long hauler clinics, or these post-COVID clinics, particularly at the one I'm familiar with at Johns Hopkins, the approach there is to bring in all the disciplines, right? So to bring in neurologists and to bring in, you know, pulmonologists to focus on lungs, because, you know, we've learned that the virus can attack multiple organs and people have different kinds of lingering issues. So it's not one thing that people are experiencing, it's many, though oftentimes we hear the shortness of breath or the fatigue. There are just a lot of unknowns at this time. I did interview one pulmonologist who's very involved, is one of the co-founders and co-directors of the post-COVID clinic at Johns Hopkins. And I asked her, what do you tell people when they ask you, you know, this is going to go away, right? And she says, I'd have to tell them, I don't know. And, you know, oftentimes when people come into a situation with preconditions, you know, it's clear, the prognosis is clearer, right? But there are some real anomalies here. I mean, there are instances of like long distance runners in their 30s or 40s, you know, experiencing long-term symptoms, and there aren't a lot of good answers for them yet.
It is the hardest answer to hear, that we don't know, and we don't know yet. I want to touch on this because I did say we would talk about it earlier, how to reopen schools safely. And just this week, we heard the new head of the CDC saying teachers do not need to be vaccinated for buildings and schools to open and operate safely. Do you think that's where we're headed? That parts of life are just going to start reopening even as we're trying to catch up with vaccinations?
Yeah, I mean, I think this school issue is a really complicated one because, you know, obviously you're trying to balance getting kids back into learning and putting them into an environment that's so important for them with the risks of, you know, exposure. And I think, so, okay, let me just walk you through how I've seen the understanding of all of this unfold. A year ago when schools, well, March of last year, so 11 months ago when it was sort of like, let's shut down schools, you know, it wasn't clear to what extent children were vectors. Like, it wasn't clear to what extent children were spreading, right? We know a lot more about that now. What we know is that children, yes, they get the virus, yes, they can spread it, but they are not as good at spreading it as bigger people, as older people, right? And then what we also know is that when they're masked and when they're distanced, schools can stay open without a lot of transmission within the school, right? And so, like, a lot's been learned. There was a study published in Pediatrics just a few weeks ago by a researcher at Duke University who I actually just spoke to yesterday. And his point is like, look, he looked at 11 counties, I believe, in North Carolina that did open in the fall. And studied what were the transmission dynamics and what precautions, what mitigations need to be in place to stop that. And they basically showed, it is possible to really limit spread and keep schools open, see very limited secondary transmission when you have everyone masked, everyone distant, stop the bunching in the hallways, right? And so his point was, even if there is community transmission in your community, there are ways to open schools, right? You have to keep them, the whole thing is the density and the spacing, right? And so that takes resources. I would say that's the biggest thing. That takes resources and it takes know-how, right? And it takes teachers patrolling masking, and it's a lot of wear and tear on teachers. Not everybody agrees with the new CDC director that teachers don't need, that vaccinating teachers needs to be I think her point was, of course, vaccinate teachers, but vaccinating teachers isn't a prerequisite to opening schools. I think people disagree with her. I mean, I think there are some researchers who say teachers absolutely positively need to be vaccinated to protect themselves, given how many people they're coming into contact with. So, I think it's a tricky issue, but I think it's now clear that schools need to open, they can open, and when it's done well, and there's the resources to follow all those mitigation steps, it can work.
Yeah, a big question for so many of us, and it could potentially be a game changer in how we go forward. And I know that the question I see popping up a lot is why is it that restaurants and bars would start to reopen and we still don't have our kids back in school?
Well, last summer, if you actually go back and you look at what infectious disease folks were saying, way early on in the pandemic, there was this case being made of like, look, what we need to do to open schools is to lower community transmission. How do you do that? You close the places that are happening. So if you care about having kids back in school, then you got to close bars and restaurants, period, full stop, right? It's not that people haven't realized this. It's just the political, it was hard to make that happen. It's hard to make that happen.
Yeah. And I don't think, people have got hard questions for how the public in general has handled this. I know there's a lot of side eye and finger pointing at people who are not wearing masks all the time. I want to get to this question from Chris on YouTube today. At some point, will the vaccine become required, like a flu shot, for healthcare workers at some hospitals and other kinds of facilities like that?
It is possible. Right now, the vaccination manager at Johns Hopkins University said they will not require any of their employees to get the vaccine because it is not, technically right now it's under emergency use authorization. So it's not, it's authorized for use, but it's not approved, right? There's because it's new, and given this EUA status, they did not want to say you must get this vaccine. Now, eventually that may change. I do know that one company that runs long-term care facilities has said they will require their employees to be vaccinated. So I think TBD. Right now, most hospitals are encouraging it and educating people, but not requiring it.
Allison, I know you've reported for NPR's Life Kit on one particular aspect of this pandemic, and it's around how many of us have soothed ourselves as we've been isolated at home, filled with anxiety in a lot of cases. And we've been drinking more, apparently, a lot more. Sales of booze were up around 25% by the middle of the last year. So just asking for some tips from you. How do we cut back? And I just want to say I'm asking for a friend, and I will just be taking some notes.
Oh gosh, I think people drink for a lot of reasons, and in our society, you don't really have to have a reason because drinking is so socially normed at everything from funerals and weddings and everything in between, right? Like, what do you do with friends? You go to a happy hour. What do you do with colleagues? You go to a happy hour, right? So it's just like part of the fabric. It's part of a societal norm.
Mm-hmm.
So once you're home all the time, and then you're drinking at home by yourself or just with whoever you live with, I think a different set of questions arises. And I think a lot of people, once they realize they're drinking out of a habit, and then they start realizing there are consequences to that habit. Maybe like once you start drinking, you really don't get anything else accomplished. You don't read, you don't get your chores done. You don't, you kind of just feel lazy and fall asleep. Well, then you start asking yourself, is this the way I want to be going through life? And a lot of people realize, no, I don't want to be going through life like this. So you start to reevaluate. I mean, look, I think awareness is the first step, like asking yourself, when do I drink? Why do I drink? How much do I drink? Most people say, oh, I'm a social drinker. And then when they actually start tracking it, they realize, oh, maybe I do drink more than what is, considered healthy, which is 1 drink a day for women, 2 drinks a day for men. And so I think when you start taking an inventory of how much you're drinking and asking yourself some basic questions, that's the first step. I mean, I think the easiest thing to do when you decide that you don't want to drink as much as you're drinking is that you replace the habit, right? If you're used to pouring that glass of wine at 5, well, then you get a new routine. You roll the yoga mat out at 5. You head out the door for a walk at 5. You replace the habit because we are creatures of habit.
Absolutely. Good tips. Thank you, Allison, the voice of reason for me and many others as we try to make our way through this. Allison, it's been a treat talking with you. Thank you so much for sharing your perspective, your reporting, your latest tips with us. We really appreciate it.
All right. Thank you very much for having me.
Thank you, Allison Aubrey. She is a correspondent for NPR News, whose stories can be heard on Morning Edition and All Things Considered. Allison is also a contributor to the PBS NewsHour, and she is one of the hosts of NPR's Life Kit podcast. I want to say thank you to KUOW's events team, Charlotte Duran, our events manager, Tio Popescu, our graphic design lead, Robert Jacob Springer, our broadcast technician, Bridget Anderson is our partner marketing manager, Juan Pablo Chiquiza is our social media strategist, Amelia Peacock is our marketing communications manager, and Megan Farmer is KUOW's amazing photojournalist. Thank you to everyone in our audience who joined us tonight. If you're watching on YouTube today, please subscribe to our channel below. Our next First 100 Days virtual event is coming up on Thursday, March 11th. It'll be on education with KUOW's Morning Edition host, Angela King, and NPR's education correspondent, Anya Kamenetz. To find out more and RSVP for the next event, just go to kuow.org/events. Thank you so much for joining us, and have a great evening.